A frequently asked question in my chiropractic practice is, why does my neck and shoulder blades hurt so bad after I've been on my laptop? So I've got a handy dandy laptop to use here as an example, and I'm sitting in a really common position that people use their laptops in, sitting on a couch. Sometimes folks will use a laptop on their desk or on a kitchen table as well. And all the tips we're going to talk about today does apply to those other environments as well. So the biggest problem with your laptop is not the keyboard, it's the screen. The screen is way too low for proper neck positioning. Normally, when we have someone at a desktop, we tell them make sure that screen is positioned so the top of the screen is at eye level, which would be all the way up here. On a laptop, that screen is all the way down there. Now, I suppose you could look like out of the lower part of your eyesight and see that screen, but human nature is to point their nose or whatever they're looking at. So I'm going to end up looking down like this as I'm working on my laptop. Now, for a while, that's going to feel okay. But with time, it puts a lot of strain on not only the muscles in your neck, but also the discs in your neck. Discs are actually soft and movable, especially in those under the age of 50. So when we're in that forward head position, flex position for a long period of time, it puts extra strain along the back part of the disc. And like I said, for a while, that's fine. But if you do it over and over and really keep stressing those tissues, sometimes you can have an injury result. Sometimes it's just a little fissure, a little irritation. Other times it can actually be a full herniation, depending on how long you've stayed in this position. And disc problems in your neck can not only cause neck pain, but can cause headache pain. It can cause radiating pain down your arms, and then also can cause a lot of shoulder blade pain. Majority of the time when someone comes in my office and they're complaining about pain in between their shoulders or along their shoulder blade, it's coming from their neck, not actually from their upper back. So to fix this problem, first of all, minimizing your time and use of a laptop is highly advised. Take breaks, every half hour, get up, stretch, move around. Also, trying to use good ergonomics to the best of your ability. Actually, I've got a little handy dandy lumbar roll. My patients know I love using these lumbar rolls. So putting a lumbar roll here in your low back can actually help you keep better upright posture for your neck. And then trying to use the lower part of your glasses or your eyesight, I say glasses because I wear glasses, but lower part of your field of vision to look at your screen versus going down like this and looking at your screen. Those are all things that you can do to help this be more ergonomic. Be careful about putting your laptop up on something high to get that screen at the right height, because then it's going to change the ergonomics for your wrists and hands, and you're going to be a much higher risk for tendonitis and carpal tunnel, which I don't know if that's a very good trade-off. Now, if you're in a situation where you have to be using a laptop and there's really no getting around it, taking frequent breaks, that's number one. Every half hour, getting up, moving, if it's just standing up, reaching up and overhead. And there's a couple of different neck stretches you can do too, just to kind of help relieve pressure. The first one I like to do is called a neck retraction. So you just slowly pull back like this, creating like a triple chin here, keeping your nose level with the horizon. As you do this, my guess is you'll probably feel some stretching going on here. That's helping reverse that forward head position that you get in when you're on your laptop. I would do about 20 of those every few hours to help relieve pressure. That's one thing you could do. Another stretch, if that one doesn't seem to be aggressive enough, is to retract back your head and then go all the way back in extension like that. So again, it's a retract and then all the way back into extension. If you think about it, that position of retract and extend is exactly the opposite position of you typing and looking at your laptop. So it just reverses the pressures on the spine, helps those discs take a little pressure off the back of the disc, and help things kind of feel better, move better, and hopefully take some pressure off of the nerves back there. If you have any other questions about using your laptop, chiropractic care, or strengthening things that you can do to help basically technology use not be quite as painful, please let me know. My website's www.ducatchiropractic.com.